Good morning.
Good morning.
Ellarku vanakkam. I hope everyone is having an amazing morning today. Thank you very much for being with us. On behalf of Kauvery Hospital Radial Road, I invite our esteemed press members and guests at the launch of Kauvery Integrated Stroke Center. So, Vati nalla oru kaithukai pottala because it's a very very special occasion. So, the special occasion, like I told you, we are going to talk more about stroke and how to prevent and all of it. Today, we have with us Dr. Krish Sridhar, Group Mentor, Neurosciences and Director, Institute of Brain and Spine, and his entire team. We welcome him. Dr. Anil BG, Medical Director, we all please clap again. And Mr. Karthik Ramamurthy, General Manager, Operations, Kauvery Hospital Radial. So before we move on with what exactly is going to happen, can we all invite Mr. Karthik Ramamurthy, General Manager, Operations, to please come forward and do the welcome note. Okay. So we will be inviting Dr. Anil BG, Medical Director, to please come forward and deliver the welcome address with a big round of applause.
Thank you so much. For us today is a very celebratory day because today we are launching our Integrated Stroke Center, and at Kauvery we always believe in following evidence-based practice. We believe in having the most international standards and yet having the outcomes that are comparable with any standard organization in the world. So on this occasion, I extend my warm welcome to all the patients who have been through a stroke, a journey as themselves or as a carer for a stroke. I welcome all the friends, colleagues, doctors who assembled here. Let us all come together, bring awareness and also share our experiences and ensure that today we are going to give due importance to stroke. We are going to ensure that stroke center is developed as an integrated care. We not only talk of preventive aspects but also we are going to talk of the entire gamut of treatment and the rehabilitation. So Dr. Sridhar and team have put together an integrated program for purpose of stroke. So I take this opportunity and welcome everyone to this program, and I'll let the honors be done by Dr. Sridhar and team. Thank you.
So எல்லாமே சேர்ந்து நல்லாவே கை தட்டலாம் தெரியுமா? Thank you. So correct timeல டாக்டர் கன்சல்ட் பண்ணி அதுக்கான சொல்யூஷன்ஸ் எடுக்கிறது இஸ் வெரி வெரி இம்பார்ட்டன்ட் when it comes to stroke. ஸோ இன்னைக்கு நிறைய விஷயங்கள் இன்ஃபர்மேஷன் ஷேர் பண்ணுறதுக்காக நம்ம கூட இருக்காரு டாக்டர் கிரிஷ் ஸ்ரீதர், who is going to talk more about stroke care. So with a big round of applause, can you please welcome him onto the stage?
Good morning. Kaade kekala. Good morning.
Good morning. Good morning.
இப்போதான் காது கேக்குது. வணக்கம், welcome. Thank you very much in the hot Wednesday morning இங்க வந்ததுக்கு எல்லாருக்குமே, our patients who have had their trust in us and the press for whom I am going to give a job. The number stroke, why are we interested in stroke? What is stroke? That's the first question. A lot of people believe stroke na you have the heart attack. Oh, stroke na heart attack, நெஞ்சு வலி. இது கிடையாது. ஒரு stroke na அது வந்து ஒரு பிரெயின் அட்டாக். அண்ட் இந்த பிரெயின் அட்டாக்ல 2 டைப் ஆஃப் பிரெயின் அட்டாக் உண்டு. ஒன்று வந்து the blood vessel to the brain gets blocked, அது ஒன்று. ரெண்டாவது ஒரு ப்ளீடிங் இருக்கு. ஸோ ரெண்டுமே ஸ்ட்ரோக் தான். ஸோ ஸ்ட்ரோக் மீன்ஸ் பிரெயின் அட்டாக். நான் இப்போ பிரெயின் அட்டாக் வந்து இஸ் இட் வெரி காமன், ரொம்ப ரேர், கேள்விப்பட்டதே கிடையாது, அப்படிதான் எல்லாரும் ஒரு மாதிரி நினைப்பாங்க. பட் ஆக்சுவலி பார்த்தாக்க it is very, very, very common, as common as a heart attack. World statistics are there. We are not getting the slides. We are not getting the slides. Yeah. So this is what, you can either have a block or you can have a bleed. So world statistics are there to say how common a stroke is, a brain attack is. Every 40 seconds somebody suffers a stroke. Every 40 seconds. 1.1 million people are living with after effects of stroke, and there is 12.2 million new strokes every year in the world. And World Stroke Organization enna sollirukuna, 1 in 4 of anybody will suffer a stroke at some point of time in their life, which means that 4 பேர் இருந்தாக்க அதுல ஒருத்தர் வந்து definitely they will have a stroke at some point of time. That's how common it is, and that is why we must know that stroke exists, and that we must spread awareness that what is stroke, how do we recognize stroke, and how do we prevent stroke. After that, how do we treat stroke? It is very important to recognize stroke. The recognizing stroke comes with the BFAST, BEFAST, balance, eyes, face, arms or leg, speech. In the 5 விஷயத்துல ஏதாவது any one of these has a problem, it is immediately time to call the hospital. Why is it time to call the hospital? Because every second the brain does not receive proper blood supply, 30,000 blood cells die, 30,000 brain cells die every second, and in a minute 2 million brain cells can die. That is how important time is. Therefore we say time is brain. We say golden hour, but now we don't talk about hour, we talk about platinum seconds. That is how important it is that we have do things in time and save time, because minutes can save lives, seconds can save lives, and that's why it is very important to spread this awareness that anybody with even a suspicion of a stroke has to go to a proper stroke center or a stroke enabled hospital which has all the types of treatment for stroke. Otherwise patients will be having to go from one place to another. We are very happy to say that in the 1 year that we are here in this new hospital, we have treated over 150 strokes, and in the 10 months or so, thank you, and more importantly, in the 10 months or so that we have actually done work, we have received the Gold Status Award from the World Stroke Organization. That only shows that with increasing awareness, with an integrated stroke care, we can help people recover, we can save lives, we can reduce their disability. Now we are talking about integrated stroke care. So what does that mean? What it means is it is not just one department which is working. It does not mean that it is one doctor which is working, but it is a team of doctors, a team of departments which work. And that is what gives the best of patient outcomes. If you look at here, from the ambulance service to the emergency room, to the neurocritical care specialist, to the neuroradiology where CT/MR is done, to the neurologist who can give drugs, to the endovascular intervention specialist who can do procedures in the cath lab, to neurosurgery, and finally, last but not the least, to neurorehabilitation. Everybody has to come together and deliver the best to the patient. If you do that, then you can reduce disability, save lives, and remember, we can even reverse a stroke. We can even reverse a stroke. But for this, patients have to reach early to a stroke-enabled center, to a center where all this is available properly. If that happens, then the patient's chance of becoming normal again is the best chance. And that is what I said in the beginning, I'm going to give the press something to do. I want you to spread this awareness that there is a chance now in Chennai. You don't have to go outside, you don't have to go abroad. This question of going abroad is all now gone. In Chennai, it is possible to do it. And here we are going to launch, and we are doing the work like this as an integrated stroke service. And at this point of time, I think I would like to recognize and felicitate some of our patients who have put their trust in us, so that we have been able to show that good stroke work gives good results. So, could I call on our MC to call on the patient?
Ms. Salit Jyotika.
Please come on stage. Now she is a nurse who is working with us. And she had some symptoms of stroke. She came to our ER. She was recognized immediately. IV clot busters were given, and she is now normal and back to working. So a big applause for her.
I invite Dr. Swati, Dr. Harish and Dr. G. Satish to please come forward and felicitate Ms. Salit Jyotika, our stroke champion.
Dr. Swati. Where is Go ahead. Swati, ma'am.
Can we all please give a big round of applause?
Madam, camera. Sir, close one.
And we are going to pin on her a champion badge. So she becomes the champion of our stroke service. Let's pin this badge. Thank you very much. We now have the story of Mrs. Leela, who's 66 years old. She came with weakness and slurring of speech. She was diagnosed with a stroke with a block in a major blood vessel of the brain. So when there is a block in a major blood vessel of the brain, what is the treatment of choice is immediately rush them to the cath lab, where cardiac all stenting is done in a cath lab. So similarly, she was taken to the cath lab. Dr. G. Satish did what is called a mechanical thrombectomy, and now she is fine. Unfortunately, she is held up. Her family could not bring her. She is doing well. So we are going to request.
Yes, I request Dr. Punaya Vanamurthy and Dr. Sindhu Priya to please come forward And on behalf of Ms. Leela, I request you all to please felicitate Mr. Sendamare.
Mr. Sentamre.
Mr. Sendamare.
So Sentamre is one of our EMT people, emergency technicians, who helps shift people from their homes to the hospital so that they get care on time. And there is a lot of work which these EMT do. We don't realize that, but they help transmit information, stabilize the patient in the ambulance itself. So thank you. Thank you.
No.
We would now like to tell the story of Mr. Sendil Kumar. Please. Now, he had a sudden onset of giddiness. Like your family also come. Followed by loss of consciousness. We did an urgent CT scan. We saw that there was bleeding in the brain. And then we had to do a small surgery, and then he was looked after in the ICU. And he is now, how you see today, perfectly normal. The reason is in time. Recognition and treatment in time. So we would like to felicitate him and say thank you for placing his trust in us.
I would like to call upon Dr. Emmanuel Das and Dr. Veena to please come forward and felicitate Mr. Sendil Kumar, our stroke champion. Can we all please give a big round of applause?
I think you people are better at these pins. Done. Thank you so much. We would now like to call upon Mr. Shekhar. He is 65 years young and he had sudden onset headache with difficulty in walking. He came to the emergency, it was noticed and recognized as a stroke, so a CT scan was done which showed a bleeding in the brain. Immediately an angiogram was done which showed what is called an aneurysm which had bled in the brain, and a coiling procedure with a flow diverter was done by our intervention specialist. And we would like to say thank you for placing our trust in us. He has done well and is now back to normal.
And to felicitate him, I invite Dr. Sriram Vararajan and Dr. Raman Ramesh Nair to please come forward. And can we all please give a big round of applause to our stroke champion, Mr. Shekhar.
I'd like one of you to put the badge on.
Group.
Thank you. We now come to the story of Mr. Sujit. Sujit sir, he is a Kauverian. He is one of our own. You can see from the logo, he works with one of our sister departments. He had fits because of which he fell from his two-wheeler. He came to the emergency, he was recognized as a stroke, and he had something called cortical venous thrombosis, because where the blood vessel from the brain to the heart is blocked, and that was treated in the ICU, and he is now back to work. So thank you very much for placing your trust in us. We would like to felicitate him.
And to felicitate Director Dr. Muthukumaran to please come forward and felicitate Mr. Sujit, our stroke champion.
I would also like to call Mr. Puratchi, in charge of our neuro rehabilitation.
Close.
Thank you, Sujit. All these stories show that early recognition and early coming to the hospital, an integrated team can create wonders, can get the patient back to their life, and that is what we want to do today. Today is a very special day also because of two reasons. One is, it is the World Mechanical Thrombectomy Day. I just told you a patient had mechanical thrombectomy where a clot in a major blood vessel was removed in the cath lab. So today is recognized as Mechanical Thrombectomy Day because we know now that the results of treatment of stroke become better almost twofold if mechanical thrombectomy is done in time. And therefore people have to have awareness that such a thing can be done. The second reason is that we have just completed and celebrated world over the World Nurses Day. Without nurses, we cannot do all this work, so a big applause for our nurses as well, who look after all these stroke patients. So on this wonderful day, we would like to announce the launch of our Kauvery Integrated Stroke Care.
Thank you, sir. And I think we all have to give a bigger round of applause to Dr. Sridhar for making wonders at Kauvery Hospital, Radial Road. And along with Dr. Sridhar and the stroke team, I would like to invite leadership Dr. Punaya, Dr. Sriram, Dr. Satish, and Dr. Meena to join us on stage. Dr. Anil PG and Mr. Karthik Ramamurthy to please join them for the unveiling of the Kauvery Integrated Stroke Center logo. A big round of applause and welcoming all of them on stage.
So one thing I would like to correct what she said. I have not done anything. It is all these people who have done it. I am just standing in front of you, that's all. I just make the noise. So we would like to unveil the logo of the Kauvery Integrated Stroke Center. Now this Kauvery Integrated Stroke Center is an advanced and comprehensive center for stroke, and associated cerebrovascular disorders, which means that all disorders dealing with blood vessels of the brain. So this is an integrated center because, like I told you, that flower is not complete without, even if one petal is not there. So all the petals are needed to complete that flower and to give the best of outcomes for our patients, because ultimately we are here to give our patients best of outcomes and the best chance at recovery. And I think it is our responsibility and all your responsibility to increase awareness in society that we need to recognize stroke fast, we need to shift a patient to a stroke-enabled center fast, so that we at the hospital can do our work fast and give out the best of results. Thank you very much.
Be ready for the Q&A session, and a big round of applause to the entire team of Stroke Center. Congratulations on launching Kauvery Integrated Stroke Center.
Yeah, they got on. Can we have another mic for the, now we would like to know if you've got any questions. Please. Manoj, can somebody handle the mic on the floor, please? I'll take that mic. I also want Dr. Ponnaya, Dr. Sriram, Dr. Satish Ji on stage, and Dr. Meena. Yes, please.
How can I recognize strokes?
To recognize stroke, just remember, be fast. B-E-F-A-S-T. B-E-F-A-S-T. B is for balance, which means that tala suttal, tallarde, nadanda ipdi tallarde, all that is balance. E is for eyes. Any problem with vision, whether it is double vision, you cannot see properly, it is blurred vision, it is hazy vision, any problem with vision or eyes. F for face. If the face is drooping on one side, then that's a problem. A is for arm or leg. Suppose the arm, you are not able to hold your phone, you cannot hold your pen, you are writing, suddenly you cannot write. Or you are walking, suddenly your leg does not come. S is for speech. Speech does not come properly, or suppose the correct word you want to say is not coming out. So any problem with balance, eyes, face, arms or legs or speech, these are the recognizing points. Any problem, you should not even think, you should just call a hospital.
Sir, 4 பேருக்கு டெஸ்ட் பண்ணா ஒருத்தங்களுக்கு இருக்குன்றீங்க.
இல்ல, அது நான் சொல்லல. உலகத்துல 4 பேர்ல இருந்து ஒருத்தருக்கு எப்பவாவது ஸ்ட்ரோக் வரும். இப்ப 4 பேர் டெஸ்ட் பண்ணா ஒருத்தருக்கு ஸ்ட்ரோக் இருக்கும்னு நான் சொல்லல. யாராவது ஒருத்தருக்கு ஸ்ட்ரோக் வரும். ஸோ நம்ம 4 ஃப்ரெண்ட்ஸ் உட்காந்துருக்கோம், டீ காஃபி சாப்பிட்டு இருக்கோம்னா அந்த 4 பேர்லேருந்து யாராவது ஒருத்தருக்கு டெஃபினட்டாக ஸ்ட்ரோக் ஃபியூச்சரில் வர்றதுக்கு வாய்ப்பு உண்டு. Like all other problems, there are lot of preventable factors and non-preventable factors. Stroke like non-preventable factors வந்து நம்ம ஒன்றும் பண்ண முடியாது. For example, suppose family diabetes வருது, family high cholesterol problem இருக்கு, அது நம்ம எஸ்கேப் பண்ண முடியாது. But we can avoid cigarette smoking, we can avoid improper diet, we can be healthy by exercising properly, we can control, if we have got diabetes, we can control diabetes, we can control hypertension, all that we can do. So there are controllable factors and non-controllable factors. So if we can make the controllable factor 0, then our risk of getting a stroke becomes down. So if நிறைய apps are available online also called stroke riskometers. So you can just go and put in your data. You will show whether you are obese, whether you are overweight, whether you are smoking, and all those factors part there. It will give you a scoring. How high is your risk for getting a stroke? So you can alter that by altering your lifestyle. It is available online.
Is it deficiency or a disorder, sir?
அப்படினா என்ன அர்த்தம்? What is deficiency means when something is less. Disorder is a problem. It is a problem. It's a problem.
Is there any tremor and
Tremor is a symptom. Tremor na கை நடுக்கும். அதுதான் tremor. Tremor-ஓட காரணங்கள் ஒரு 10, 20, 30 இருக்கும். சரியா? Stroke வந்து one of the causes of tremor. சரியா? So tremorங்கிறது வெறும் கை நடுக்கம். கை நடுங்குது. இதை எடுத்தா கை நடுங்குது, ஒரு பாயிண்ட் பண்ணா கை நடுக்கும். அதெல்லாம் நடுக்கம். But நடுக்கம் can be a symptom of stroke, but it can be a symptom of other things also.
இது என்ன ஏஜ் குரூப்ல வரும் சார்? மினிமைஸ் ஏஜ்.
We used to think that stroke is of the elderly also. We used to think. But now we know that it is coming in younger populations. We used to think after 55, 60 only strokes are more. Then after some time we came to realize that it is seen also in the younger population. But after COVID, we are seeing it in the much more younger people.
Is it hereditary, sir?
Sorry?
Hereditary.
Stroke as such is not hereditary, but the factors are hereditary. For example, diabetes, hypertension, high cholesterol, all those can be hereditary and therefore you can have it.
Sir,
Somebody
taking of ice water and the food habits.
Ice water has got nothing to do with it. But food habits have. So unhealthy food habits are not good for any problem. It's not only for stroke. Unhealthy food, that is, excess of anything is bad.
Mostly non-veg.
I won't say non-vegetarian food can give you high amount of protein, which is very good, but you should not have a lot of fatty non-vegetarian food, which is fried. So you are having a fatty non-vegetarian food which is fried, which is bad. And if you have that every day, so if you have, say, fish is lean meat, fish is good. So it is, anything in excess is bad.
சார் கோவிட்க்கு அப்புறம் அதிகமா இருக்கு, நீங்க அந்த வேக்சினேஷன் இன்ஜெக்ஷனால.
Not because of vaccination, because of the COVID problem. During COVID itself, we saw a high number of heart attacks and strokes in young. That is a proved thing all over the world. And the after effects of COVID are also being seen. Please, it has got nothing to do with vaccination.
சார் ஒன் மோர் கொஸ்டின். அந்த கோவிட் டயத்தில் யாருமே மேக்ஸிமம் ஹாஸ்பிட்டலுக்கே போகலைன்னு ஒரு ரிப்போர்ட் இருக்குது.
அவசியமா போக வேண்டிய பேர் வந்து போனாங்க. நர்சஸ், டாக்டர்ஸ் எல்லாருமே போனோம். இல்ல, பேஷண்ட்ஸுக்கு we have even done surgeries during COVID. For us, people who came with strokes were treated, people who had brain tumors were operated upon. So those who needed to go to hospital went to hospital. But chumma nato kai kaal valikirudhu na hospital poi doctor paakaren, that was avoided. That was avoided.
Why?
Because you don't want to get COVID. I mean, at that point of time, everybody was scared. Even we were scared. We never knew when we are going to get COVID. So everybody was scared. So you went only when you had to.
Psychological fear.
Yeah. Mic, pinadi. Any further questions?
Thank you.
Thank you everyone, and thanks to Dr. Krishna and the entire team of Institute of Brain and Spine for being so patient with us and answering all the questions. Thank you, sir. Thank you very much. And thanks to each and every one of you who decided to have their presence here today in this amazing special occasion. Thank you, and thanks. Thank you. Deputy Medical Administrator, to please come forward and deliver the vote of thanks.
அனைவருக்கும் வணக்கம். On this momentous occasion of the launch of Kauvery Integrated Stroke Center, I sincerely give my gratitude to each and every one of you who has participated for this important milestone. My first thanks to the stroke champions here for taking your time and being a part of this event, and you are the real heroes. And thanks to Dr. Sridhar who has envisioned this Kauvery Integrated Stroke Center to function as a rapid stroke unit which is equipped, as he told, with expertise, advanced facilities and integrated treatments which is par to international standards. And thanks to our founder and chairman, Dr. Chandra Kumar, and our leadership team, Dr. Anil, our medical director, Mr. Karthik, GM Operations, who had made this advanced stroke care accessible to everyone. And thanks to the members of the press for your presence and continuous support. And as we heard from Dr. Sridhar, when it comes to stroke, every second counts. And here at Kauvery Hospital, Radial Road, we'll ensure that no time is wasted to change people's lives for better. I want to thank once again each and everyone for taking part in this event and making this launch a grand success. Nandri Vanakkam.
Thank you, Swarna, and one more time, congratulations to all the stroke champions. Stay healthy and stay happy. Thank you very much for this amazing gesture. Thank you. Thanks to everyone.